Hi, this video is about the respiratory system, a concept related to the diffusion of the gases uh, across the respiratory membrane. So, let's understand first what is this respiratory membrane, what are the layers of the respiratory membrane, how would the gases diffuse across this respiratory membrane, and what would be the rate of diffusion of those gases, and how do we measure the diffusing capacity. So, starting with the very basic, we inspire oxygen, it goes through the respiratory passages, and finally it reaches the alveoli. This is a diagrammatic representation. The inspired oxygen traveling through the respiratory passages, finally reaching the alveoli, and from the alveoli the oxygen will diffuse into the pulmonary blood, and the carbon dioxide coming from the tissues and having entered the lungs, it will diffuse in the opposite direction from the blood into the alveoli, so that it can be expelled out via the expiration. So, we are talking about this alveolo-capillary membrane. There is alveolus and there is pulmonary capillary. Therefore, the diffusion of gases occurs across this respiratory membrane. Let's try to understand the layers of this respiratory membrane first. Here is the alveolus and here is the pulmonary capillary. So, first thing, the first layer, and I am talking about the layer from alveolus to the pulmonary capillary. Therefore, starting from alveolus in that direction, first layer would be that of alveolar epithelial cells, epithelial lining of the alveoli. You know, these epithelial cells are called as pneumocytes. There are two types, type 1 and type 2, and the gas diffusion occurs across type 1 pneumocytes. So, first layer of the respiratory membrane would that be of alveolar epithelial cells, epithelial lining. Then next, the basement membrane on which these epithelial cells are based. So, second layer is of the basement membrane. That is the basement membrane for the alveolar epithelial cells. Then the interstitium, as you can see, between the alveolar wall and the pulmonary capillary, pulmonary blood vessel, there would be interstitial space. So, there would be interstitium. This is the alveolus, epithelial lining, then the basement membrane, then the interstitium, and now starts the pulmonary capillary, the pulmonary blood vessel. So, it starts with the basement membrane of the endothelial cells. So, the basement membrane of these endothelial cells or endothelial lining has the basement membrane, and then the endothelial cells that line the pulmonary capillaries. Endothelial cells lining the pulmonary vessels or pulmonary capillaries. So, oxygen which has reached the alveolus now has to cross all these layers to reach the blood vessel. It has to cross all these layers to finally enter the blood. Having entered the blood vessel, having entered the blood, it has one more membrane to cross actually, and that is the RBC membrane, because oxygen is going to enter the red cells and going to combine with the hemoglobin. So even RBC membrane has to be crossed. Therefore, this is the capillary, pulmonary capillary, and here is a blood vessel, here is the red cell, red blood cell. Oxygen has to cross all these layers. Let's just summarize: pulmonary, I beg your pardon, alveolar epithelial cells, pneumocytes, then the basement membrane, then the interstitium, then there starts the pulmonary capillary, as we saw here, the pulmonary capillary, the basement membrane of the endothelial cells, then the endothelial lining, endothelial cells, and finally entered the blood. And then it has to enter the red cell, RBCs, so red cell membrane. These are the layers of the respiratory membrane, and carbon dioxide of course has to diffuse in the opposite direction. It diffuses from the blood into the alveolus and it will be expelled out. So this carbon dioxide has to cross all these layers in the opposite, the endothelial lining, then the basement membrane, interstitium, and then it has to enter the alveolus, crossing the layers. So that's the respiratory membrane, the layers of the respiratory membrane as we have enumerated. Now next point is what all factors that influence this diffusion of gases. For instance, we are talking about the diffusion. So there are factors influencing the rate of diffusion which are applicable very much here. For instance, thickness of the respiratory membrane. The rate of diffusion is inversely proportional to the thickness of the membrane or diffusion distance. Greater the thickness, lesser will be the rate of diffusion. For instance, pulmonary edema, accumulation of fluid in let's say interstitial space will increase the thickness of this respiratory membrane, and therefore oxygen diffusion would be its rate of diffusion will decrease. Oxygen, carbon dioxide, the rate would decrease. So inverse relationship. Or interstitial lung disease. Interstitial lung disease will also increase the thickness of the interstitium and therefore thickness of this respiratory membrane. Therefore the gas diffusion rate would decrease. Second, surface area available for diffusion. As we all know, greater the surface area available, greater would be the rate of diffusion. Diffusion of gases is proportional, directly proportional to surface area. Now, there is a condition called as emphysema, pulmonary emphysema. What happens in this condition is that the surface area available decreases. What happens here in emphysema is that there is destruction of the alveolar septa. Just to show it diagrammatically, there is destruction of the alveolar septa and alveoli coalesce to form larger cavities. But what happened in the bargain is surface area available for gas diffusion would decrease, and therefore the rate of oxygen and carbon dioxide would also decrease. So decrease in the surface area as caused in emphysema, decrease rate of gas diffusion. These are some of the factors influencing the rate of diffusion of gases through this respiratory membrane. Now the real question is, what is the rate of diffusion of gases through the respiratory membrane? What is the diffusion capacity of the respiratory membrane? So, under normal circumstances, the diffusing capacity of this respiratory membrane is said to be 23 to 25 ml per minute per mm of Hg. 23 to 25 ml per minute per mm of Hg. What does it mean? It means if the pressure gradient across the membrane is 1 mm of Hg, then in 1 minute about 23 to 25 ml gas will diffuse. Now the point is, I am talking about the pressure gradient across the respiratory membrane, means from alveolus to the blood, what is the pressure gradient? If it is 1 mm of Hg, then in 1 minute this much gas will diffuse. 23 to 25 ml gas will diffuse, oxygen will diffuse. Normal alveolo-capillary pressure gradient, alveolo-capillary pressure gradient from alveolus to the pulmonary capillary blood for the oxygen is said to be about 11 mm of Hg. From the alveolus to the pulmonary capillary blood, the pressure gradient across this respiratory membrane is said to be 11 mm of Hg. So, you know, for every 1 mm of Hg, in 1 minute, about 23 to 25 ml gas will diffuse. If the pressure gradient is 11 mm of Hg, how much gas will diffuse? 230 to 250 ml, roughly about, let's say 250 ml per minute. So remember, about 250 ml of oxygen diffuses across this respiratory membrane per minute, every minute. And also remember that 250 ml per minute is the oxygen which is consumed by the body every minute. Under basal conditions of metabolism, about 250 ml of oxygen is consumed by the body per minute. So this much gas diffuses across the respiratory membrane from alveolus into the blood, and this much oxygen is utilized by the body every minute. Now, the most important part of this discussion: how do we measure the diffusing capacity of the respiratory membrane? Diffusing capacity of the respiratory membrane is generally denoted as DLco. DLco. Diffusion-limited carbon monoxide. Diffusion-limited carbon monoxide. This is how it is denoted, the diffusing capacity of the respiratory membrane. And it means, the first point is, we can use carbon monoxide to measure the diffusing capacity of the respiratory membrane. The question is why? Why do we use carbon monoxide to measure this diffusing capacity? Now, the point here is, we are going to give a gas by inhalation. Let's imagine that we give a gas by inhalation, it reaches the alveoli and it diffuses through the respiratory membrane. Now, we want such a gas that continues to diffuse through the respiratory membrane. It means we don't want such a gas that will reach the alveolus after given by inhalation. It reaches the alveolus and instantly reaches equilibrium from the alveolus to the pulmonary capillary blood. If the gas that was given by inhalation, it reached the alveoli and instantly, it diffused through the membrane and instantly reached equilibrium from alveolus to the pulmonary capillary blood, means its partial pressure in the alveolus and its partial pressure in the pulmonary blood becomes equal. It equilibrates. If the gas instantly equilibrates, very rapidly reaches equilibrium, then that gas is useless for us. What are we talking here? We are talking about diffusing capacity of the respiratory membrane to be measured. So we are looking at such a gas which should, we give by inhalation and it continues to diffuse, it continues to diffuse through the respiratory membrane. It never reaches equilibrium. Its partial pressure in the alveolus becomes high because we have given it by inhalation and it has reached the alveolus. So partial pressure of that gas becomes higher, but its partial pressure in the blood does not rise. So that means there is a pressure gradient and it will continue to diffuse, and from its rate of diffusion we will measure the diffusing capacity of the respiratory membrane. So let me give an example. To explain this further, let's take some example. For instance, let's talk about oxygen. Can we use oxygen to measure the diffusing capacity of the respiratory membrane? No, we can't. Why? What's the reason? The reason simply is, if we inhale the oxygen, it reaches the alveolus and within next 0.3 seconds it reaches equilibrium from the alveolus into the pulmonary capillary blood. Within 0.3 seconds it reaches equilibrium, it equilibrates from alveolus to the pulmonary capillary blood. That means the partial pressure of oxygen in the alveolus and partial pressure in the blood will become equal. It has reached equilibrium. So that means it diffuses so rapidly that almost instantly it reaches equilibrium. This gas is useless for us to measure the diffusing capacity of the respiratory membrane. We are looking at such a gas which will not reach equilibrium this rapidly. In fact, it won't reach equilibrium at all. It will continue to diffuse. Such a gas is carbon monoxide. Why? Why carbon monoxide? Because if we give carbon monoxide by inhalation, it will reach the alveolus and partial pressure of carbon monoxide in the alveolus will increase. It will start diffusing into the pulmonary capillary blood, but the partial pressure of carbon monoxide in the pulmonary blood will be zero. It will never rise. Why is that? That's because carbon monoxide, as soon as it enters the blood, it will be taken up by the RBCs and it will combine with the hemoglobin very rapidly. Carbon monoxide, as you may be aware, has got 200 times more affinity for hemoglobin as compared to the oxygen affinity for hemoglobin. Very high affinity. So carbon monoxide reached the alveolus, then it diffused through the membrane, reached the blood, but instantly taken up by hemoglobin inside the RBC. Which means carbon monoxide does not remain free in the plasma. Now, the most important part is partial pressure of any gas is exerted by that gas which remains free. The gas that combines with something it does not exert the partial pressure. So in this instance, as you can see that we gave carbon monoxide by inhalation, it reached the alveolus. In the alveolus, its partial pressure increased. It started diffusing into the pulmonary blood and it immediately was taken up by the hemoglobin inside the RBC. It does not remain free in the plasma at all. So it will not exert any partial pressure in the plasma, in the blood. That means partial pressure of carbon monoxide in the blood will remain zero. No free gas available to exert the partial pressure. All of it taken up by hemoglobin instantly. Which means what? Which means it will never reach equilibrium. partial pressure in the alveolus is high. We have given it by inhalation and it has reached the alveolus. So, its partial pressure high in the alveolus and 0 in the pulmonary capillary blood. So, that means it will continue to diffuse, continue to diffuse, continue to diffuse. It will not reach equilibrium at all. It will never reach equilibrium. So, that's the gas we are looking at. That's the gas that is actually ideal to measure the diffusing capacity of the respiratory membrane. Remember, we were talking about measuring the diffusing capacity of the respiratory membrane. How much gas diffuses through the respiratory membrane per unit time. We were going to measure that. And we are looking at such a gas which will continue to diffuse through the respiratory membrane, would not reach equilibrium. Oxygen was reaching equilibrium from alveolus to the blood instantly, almost instantly. But carbon monoxide never reaches equilibrium, continues to diffuse, and therefore from its diffusion rate, we can actually measure the diffusing capacity of the respiratory membrane. So, diffusion limits its equilibrium, and therefore carbon monoxide is said to be the diffusion limited gas. Diffusion limited carbon monoxide. Diffusion limits its equilibrium, and therefore carbon monoxide is used for this purpose. What you got to remember is that carbon monoxide, if given by inhalation, would never reach equilibrium from alveolus to the pulmonary capillary blood. Its partial pressure in the pulmonary capillary blood will remain almost 0. In fact, that is one reason that carbon monoxide is dangerous. Apart from the other reasons, of course, one reason is that since it never reaches equilibrium from alveolus to the blood, it continues to diffuse, Remember, if a gas reaches equilibrium from alveolus to the blood, then the diffusion will stop. But carbon monoxide is never going to reach equilibrium, and therefore it will continue to diffuse. That's one dangerous fact about the carbon monoxide or carbon monoxide poisoning. Right, so diffusion limited. Diffusion limits its equilibrium. It's called, therefore, it's called as a diffusion limited gas. And diffusing capacity of the respiratory membrane is measured by carbon monoxide, and it is denoted as DLco, diffusion limited carbon monoxide. What about the oxygen or carbon dioxide? What can we say about these gases? These gases are said to be perfusion limited gases. Perfusion limited gases. Now, what is the meaning of this? As I mentioned just now, that if we give oxygen by inhalation, oxygen reached the alveoli, and within next 0.3 seconds, oxygen reaches equilibrium. It diffuses from alveolus to the blood, and within 0.3 seconds, it reaches equilibrium. Means partial pressure of oxygen in the alveolus and partial pressure of oxygen in the pulmonary capillary blood will become equal. So, oxygen equilibrates in 0.3 seconds. Now, just add to this one more fact. The fact is that the perfusion rate to the alveoli. What is the rate of perfusion in the lungs, and how do we denote it? The rate of perfusion is said to be like this, that an average RBC stays in the pulmonary capillary blood for 0.75 seconds. This is the normal perfusion rate to the alveoli. The blood perfusion, the rate of blood flow in the lungs is denoted like this. The speed with which the RBCs travel, the speed with which blood travels, the rate of perfusion in the lungs is said to be 0.75 seconds, means an average RBC stays in the pulmonary capillary blood for about 0.75 seconds. Now, look at this. Oxygen, does it need that much time? 0.75 seconds to reach equilibrium from alveolus to the blood? No. in 0.3 seconds only, oxygen is reaching equilibrium from alveolus to the pulmonary capillary blood. It needs only 0.3 seconds. But now the next point, oxygen does need 0.3 seconds. It does not utilize all 0.75 seconds, that apart. Oxygen needs at least 0.3 seconds to reach equilibrium from alveolus to the pulmonary capillary blood. Now imagine a certain condition. Imagine a circulatory condition in which the rate of perfusion in the lungs is altered and an average RBC stays in the pulmonary capillary blood for less than 0.3 seconds. The rate of perfusion is altered. The rate of blood flow is altered in the lungs. So much so that an average RBC, which normally stays for 0.75 seconds in the lungs, now stays for only 0.3 seconds in the lungs. I mean, that's the perfusion rate has decreased to 0.3 seconds or less. What will then happen? Then oxygen will not be able to reach equilibrium from alveolus to the blood. Why? Because oxygen takes at least 0.3 seconds to reach equilibrium. It needs at least 0.3 seconds. And now there is a circulatory condition in which the rate of blood flow through the lungs is less than 0.3 seconds. An average RBC stays near the alveoli for less than 0.3 seconds. That means not the adequate time for oxygen to reach the equilibrium. So oxygen will not be able to reach equilibrium in such a condition, in such a circulatory condition. For instance, severe intense exercise, this may happen. And in such a condition, oxygen does not reach equilibrium, cannot reach equilibrium because perfusion rate to the alveoli was altered. It became less than 0.3 seconds. For this reason, oxygen and also carbon dioxide, they are called as perfusion-limited gases. They are called as perfusion-limited gases because perfusion is the factor that limits the equilibrium of these gases. Perfusion rate was altered and that was the limiting factor for oxygen and carbon dioxide also to reach equilibrium between alveolus and pulmonary capillary blood. So therefore, they are called as perfusion-limited gases. Perfusion limits the equilibrium. However, our main point was it's the carbon monoxide that we can use to measure the diffusing capacity of the respiratory membrane because carbon monoxide, if given by inhalation, never reaches equilibrium from alveolus to the blood because its partial pressure in the blood never rises. The reason being, the carbon monoxide does not remain free in the plasma. It's instantly taken up by hemoglobin. And as I mentioned, partial pressure is exerted by that gas which is free and not by that gas which combines. So that's in short the diffusing capacity of the respiratory membrane and how we measure it.